Hey everyone. I know it's been a really long while since the last video. Actually, a lot has happened in the meantime. I've been really busy running around trying to get a lot of things in order before my top surgery, which was last Thursday, the 15th of June. So I was really hoping I would get to make another video pre-top surgery. It's just that time-wise, I couldn't get around to it. So here I am, post top surgery. Um, just like small disclaimer, please disregard like my general appearance due to the fact that I'm post-op and that my range of motion is quite limited right now. It obviously affects some aspects of my personal hygiene, fashion choices, so just bear that in mind, okay? Not my best look, I know. Yeah, another very obvious thing that clearly happened in the meantime, I shaved my head. That was a little over a month ago, 13th of May. I actually have some footage of it. It's not entirely focused. Then again, you can't exactly go back and reshoot that, so I might put a short clip, maybe fast motion, to just kind of illustrate that process, but there's really not much to tell. I decided to shave my head. It's grown back significantly, the hair, since, and I've even had to have the sides cleaned up a little bit by a hairdresser to make myself look less like a dandelion. So, but again, it's grown back significantly, so I might get it cleaned up again in the coming weeks. Yeah, the big thing, my top surgery. It Up until the actual procedure or the day of the procedure, I didn't know what method or like what type of surgery I was gonna have. My doctor said that he would decide that on the spot because during our consult a few months ago, he said that I was kind of borderline between peri-areolar and double incision because, you know, obviously he would have preferred to do the peri, it being less invasive and the scarring being less than with the double incision, but the con in that sense was that I was kind of on the bigger side in terms of size. The pro was that my skin was fairly or very elastic considering my age. So he said that, you know, if maybe a few more months on T reduced the breast tissue further, maybe he would in the end be able to do the peri. And as it turns out, I was in luck because he in the end decided to do the peri, and I'm very happy with that. It was the outcome I was hoping for. As for the results, I haven't really seen them yet. I mean, I've seen it briefly for a few seconds at a time when they changed my dressing in the hospital, but then again, you know, this perspective of like looking down at your chest is not exactly how you get the whole picture. So I'm still waiting for like that moment when they take off this compression binder and I get to see myself in like a mirror and see, you know, the whole picture of what it looks like. I am, however, very relieved, and I was honestly surprised. Yesterday when I was leaving the hospital, you know, I put on my t-shirt, the same t-shirt I came into the hospital in, you know, and I look down and it's flat. And, you know, never having worn a binder a day in my life, this was something new to me. This was a new feeling, and it feels so good. And it feels like something's finally fallen into place, and I feel more like myself. And I can't wait, you know, when this heals and I can take this off and I can just go on with my life. So yeah, I was in the hospital. I was admitted on Wednesday in the morning. They did some tests. I had to sign a bunch of forms, and then basically I just stared at the wall for the rest of the day. My surgery was the next day. They came to get me at around 9:30 in the morning. You know, took me first to the anesthesiologist, then into the OR. Generally, the attitude of the staff was very polite and very respectful. I was only misgendered twice in 5 days. 4 days? 4 days. Um, Once right on the operating table, they brought me into the OR, and I guess with my chest exposed, one of the nurses who either didn't see my chart or didn't maybe know my name, because I have my name and my gender marker have been changed legally. Um, she called me man, and that really made me cringe. Um, and then another time, just before being discharged, one of the nurses also used the wrong pronouns in a conversation that we had, or like giving me instruction about post-op care. So, I mean, I'm sad that these things still happen. At the same time, statistically, I'm trying to comfort myself, this is a fairly good ratio, so it was not an unpleasant experience in that sense. Funny story, I fainted the day after my surgery, sometime in the AM. The nurses came to... They told me I could go wash off. I can't exactly shower, but I can go wash off, and they were going to give me clean PJs and change my bed sheets. And, they told me to first sit up in bed and just give my body a moment to adjust. And I sit up, and the room starts spinning, and my ears start ringing, and, I panic, and I tell the nurse, this is not good, this is not good. And she's like, no, just give it a second. And I'm like, no, this is really not good. It's I know my body, this is not okay. I'm gonna faint. And I don't think she took me very seriously, but the next thing I remember, I was lying on my back on the bed. Luckily, I never got up. I just sat up, so they just probably laid me back down. And she was holding my legs up vertically, probably to get the blood back down into my torso and my upper body. It seemed to have amused the staff. It was kind of like a running joke for a day or two. I don't know why that's so funny. My blood pressure was low. They took my blood pressure afterwards, and it was really low, which is, I guess, normal. It was in the morning. I hadn't really eaten much, not the day prior, because of my surgery, not even after, because of the possible side effects of anesthesia, so that they would avoid, they're trying to avoid vomiting at any cost. So I generally have low blood pressure in the morning. I hadn't had coffee or anything. I hadn't eaten much. I was a little dehydrated. I didn't drink enough, and that was my fault. But getting up and to go to the bathroom was really uncomfortable, and I felt really unstable and weak. And so I guess I kind of did not allow myself to drink enough so that I wouldn't have to get up so much. And in the end, they, I think, gave me 2 bottles of fluids to just kind of rehydrate me. But yeah, that was the only time I fainted during my stay in the hospital. I've been off pain medication since Saturday, which is about 3 days now. I feel some discomfort. It started itching today, probably a sign that it's healing, hopefully. So it's uncomfortable, but definitely not painful. I hadn't had a chance to speak to my surgeon yet. Since the surgery. I only saw him briefly prior to the procedure when he drew the surgical markings on me, and we discussed what he was going to do, but we didn't actually have a chance to talk. I was hoping for some feedback from him, like how it went and how he's satisfied with how it went. But I have a checkup with him, a follow-up next Wednesday, so I'm hoping to be able to get some information from him firsthand then. I'm thinking if something was wrong, they'd tell me by now. So since I'm feeling well and nobody's saying much, I'm hoping that means that it's all good and well. Yeah, I'm currently staying with my sister, and I'm supposed to go get my dressings changed every other day with my GP, which is not in this town. It's about 30 kilometers away. And I'm hoping that I can reason with them that they let me go see a doctor here, because this is really, I'm not allowed to drive for a few weeks at least, which means I am completely dependent on others, and to have to ask someone to drive me every other day to get my dressings changed is just a little silly. So I'm hoping I can manage to tell them, if I could just go to a doctor somewhere here in this town and steal 5 minutes of their time so they can just exchange the gauze that's covering my chest under the compression binder right now. The binder itself, by the way, is again, since I've never worn one before, incredibly uncomfortable. I'm just not used to this kind of constant pressure on my chest. And I can't honestly wait for the day when I get to take this off and just be done with it. Obviously, I want the results to turn out as well as possible, so I'm trying to minimize, my upper body movement. I am really trying to rest, to just take care of my body while it heals so that I can enjoy the results of this once this process is done. In other news, I have had some complications with my T shots. It's been going on for about a month and a half. It actually started in Egypt after the shot I received there. I noticed that my legs started swelling, my arms a little bit too. And I just thought maybe it was, the change of climate. It was warmer there. I didn't pay much attention. It wasn't actually painful, just uncomfortable. And it got better after a few days. And so after my next shot, when I got back 2 weeks later, it got worse. It was already bordering on painful. The arms were swelling quite a lot as well. And so I mentioned it to my endocrinologist. And she told me to immediately stop my therapy, to take no more shots, to go see my GP the same day, and then to come see her. I reported this on a Friday, and she gave me an appointment the next Wednesday, and to not take any tea until I've seen her. So I go to my GP, she checks me out, says that it's not likely to be deep vein thrombosis, which is also one of the side effects of testosterone therapy. And then when I went to see my endocrinologist, she already had the blood results from a blood sample they took about a month prior. And what they found was that my T levels were very high. Actually, more than high, they were like too high. I had too much testosterone, and that for some reason, clearly my body was not processing it the way other people are, who are on the same dose and the same interval. And so we agreed that she would take another blood sample, and on the day that she took that sample, I was 2.5 weeks since my last shot, just as a benchmark, and that I could take my next shot that Friday. So basically, instead of 2 weeks, she extended my interval to 3 weeks. And I took my shot on Friday. The swelling got bad again. This time was really painful. And she called me, the endocrinologist, the next week and tells me that she got the results. And that after 2.5 weeks since my last shot, my T levels were finally within normal range, but at the very upper end of the spectrum. And that probably with taking my next shot, I had pushed my levels over that range again, and I again had too much testosterone, and that's why my body was reacting like this. So we agreed, because that was about 3 weeks before my surgery, that I should stop taking tea anyway, a few weeks prior to the surgery, and then after my surgery, I should come see her again. She'll take another blood sample and gauge where my T levels are now, and then decide whether I should continue with my therapy now, or maybe give it a little more time for the levels to drop a little further, and then take another shot. She says that this is, all part of the process, that we need to figure out how my body's responding to it, what the right dose is, what the right interval is for me, and that, eventually once we figure that out, it will no longer be an issue. That it's not dangerous, but that she understands that it's uncomfortable and painful. So I'm off TR, I've had my last shot on the 12th of May, so that's over a month ago now. And I'm hoping to see my endocrinologist this week or next week at the latest, and hopefully be given another shot. In terms of other changes on T since my last update, my body's definitely getting hairier. I've noticed that, hair is now growing kind of on my thighs. I've never had, I've had fluff, but I've never actually had hair. Now they're kind of turning darker. Also, the inside of my thighs, there's some belly hair growing. Not a lot, but it's definitely happening. My armpit hair is actually growing, I think, faster now and they're getting kind of rougher, the hairs, stronger. I've also grown a few hairs here under my chin. Literally a few. You could count them probably. I mean, I just shaved them yesterday after coming home from the hospital, but that's probably the most that I'm getting out of facial hair. Like, it's a few hairs here. My arm hair is getting a little stronger. My voice has dropped significantly. I don't know if you can hear this, maybe compare this to a prior video, but it actually, I felt that for weeks nothing was really happening, and then like overnight I wake up one day and I'm like, what the hell is this? And my voice got really a lot lower. My voice is cracking. There are certain frequencies where like just air is coming through. I lose my voice completely. I have shocked and scared myself several times singing in the car, where I just went off tune so horribly and completely that I was really happy there was no one else in the car with me. I mean, I don't have a great singing voice. I didn't have one to begin with, but I could at least carry a tune, which is not entirely true anymore. I'm hoping that kind of gets better with time, when my voice settles a little bit. I mean, I like this new voice. I actually think it helps me pass a lot. Even in especially in situations where I'm not seen, just heard. I've noticed this on the phone after changing my name and starting to represent myself, you know, as Adam. Professionally at work, I would pick up the phone and people would be like, I'm calling for Mr. Julian. And I'm like, yes, please tell me. And they're like, oh, it's you. You know, my voice didn't match what I guess they expected. And I don't get that anymore. I think my voice is finally starting to kind of match that, and it makes me more at ease that it does. That, I think, is pretty much the most obvious changes that I've noticed. I don't think much else has been happening. Like I said, I'll be on sick leave for the foreseeable future while my chest heals. I don't know how long exactly that will be. The doctor said, you know, anywhere between 3 to 4 weeks and 6 to 8 weeks, so I guess it all depends on how well I heal. I don't want to rush anything. I don't want to do anything that I'll end up regretting. I mean, this is first and foremost about me, and I'm gonna give myself the time to really heal properly. I'll try to update this a little more now that I technically have more time. But yeah, that was it for now, for this time. Again, I'm sorry that it took so long. I'll try to do better. Take care.